Good morning, everyone. I'm Pastor Philip Johnson, a patient coordinator here at Sponaugle Wellness. This is what we call an exit day for one of our patients. And we appreciate him coming in and willing to tell the story. I know that you're going to be watching this and you'll be so encouraged by what you're going to hear. Hey, what is your first name?
My name's Tracy.
Tracy, where are you from?
I'm from Florida.
Florida. We treat patients from all over the United States, Canada, around the world, and it's always wonderful to have someone from Florida right here close to us to come in and seek treatment. You have a unique story, and it's been, I feel like it's our honor and opportunity to have had you here. You came in on a 3-week program, what we would call a detox program, and we want to spend just a few minutes talking. Well, I want to see what your life has been like. When did this start? And then we'll end up talking about where we are right now.
Okay.
So we use some phrases around here in our detox program of when someone calls, we talk about detoxing someone, getting them off a drug or an alcohol. But we always want to say that equally important to the actual detox is discovering, why somebody is chasing, the drugs or the alcohol.
Correct.
And I think that's what makes this place so very, very special.
Yes.
Because of that. And why our relapse rate is phenomenal. We're talking probably, in government standards, probably 80%, maybe 90% better than most facilities across the United States.
That I can believe.
And it goes back to a lot of this brain chemistry that we do with our patients.
This
whole drug and alcohol thing, tell us a little bit about it.
Well, it started when I was 15, had a tough life. Everybody has situations with their parents and whatever that you get into. And I was young. My parents put a guitar in my hand rather young and played in bands for most of my life and toured around the U.S. and stuff. And well, when you do stuff like that, from that day on, I mean, drugs are in rock and roll. That's part of the thing.
So it goes with the territory.
Exactly. So, and I had just been doing it for years and years and years, and then experienced everything, going through everything, tried everything, and tried unsuccessfully probably 4 times to detox through other centers. And they were always unsuccessful. You always found yourself back in the mix again, reusing again within, a few months, some of them 6 months, because the problem is that there was always a craving there. It was always you always had this thing in the back of your head that, I remember when, and, this thing just keeps going on. But it just seems that, coming here they're so thorough and the staff is so great that they get to the underlying issues behind the addiction, which is what has never happened through any of the detox that I've went through. It was absolutely painless. Any uncomfort that I did feel or felt, I mean, they took care of it right away. Yeah, they're very good about keeping you from going into that black hole of depression or withdrawal symptoms that so many people are absolutely afraid of when you talk about detox. You've tried this at home before. What's it like trying to detox at home? It's the most miserable thing you can ever experience in your life. I mean, you're talking, the first month, rolling around, can't sleep, your body aches, you're sick, you feel like you got the constant flu symptoms, and it's almost impossible to do it at home. You end up relapsing just immediately, going back immediately, because you can't take that kind of pain. Yeah. So you try to find a cheaper detox, and they may do something for you, but you're still experiencing the same pain. It may be a little bit easier, but it's still tough, and it takes months and months. I just couldn't do that. Yeah. I had a job that I had to try to maintain and lie through the whole thing. Okay. I did very well at my job. I don't want to say that I didn't, but there were days where, if you can't get up and go to work that day, you can't get up and go to work that day. And, those things catch up with you after a while. Yeah. So you end up losing those jobs, and these things happen. So you end up flipping job after job and trying to figure out what you're going to do with yourself. So what's been great about here is I'm into my 3rd week, and I'm saying even going into my 2nd week, I felt like 100% better. And the third week has been, I would say, like a light bulb just went off in my head.
Okay.
I can't explain this to anybody. It's I try to tell my family, they can say, you know, they go, wow, the way you sound is just totally different.
No kidding.
Yeah. And I figure, you know, I'm going to be able to feel it. They're going to be able to see it.
You said something very important, because these things are family things. They do affect the whole family.
Oh.
You have loved ones, wives, husbands, children that always get affected by this, and
Worse than you do.
it's very troublesome. And then it must be such a happy homecoming, I guess I should say.
Yeah, I mean, they've told me this is, you know, I feel bad because I've been without the job, and I'm like, I'm sorry, I can't do nothing for you this Christmas, because I have 4 daughters.
Okay.
You know, they're all grown and done college, and they're like, Dad, the best Christmas present you gave us is doing what you did.
That is, that's heartwarming to think about. Let's talk about the cravings just a little bit. You started this early, teenage years.
Yeah.
And what are some of the drugs? Is you okay to talk about that?
Oh, I'll tell you anything.
What did you do?
Know. Oh, okay.
Started with?
I started with marijuana.
Okay.
For marijuana, it was cocaine. And then it was, you know, it was alcohol, of course, was a daily issue, and lots of it, especially when you're in a band. That's all you do. I said after that, it got into heavier things because it was around. It got into heroin, and then it got into pain pills, and then it just, you know, it was Xanax. I mean, I you know, LSD. I mean, I could go on. I mean, it was endless, the stuff that I got into. I will say, you know, as you get a little older, there are some things that you will, you know, you'll want to drop off and not do. Like, you know, when I got out of a band, you know, cocaine wasn't around, but
yeah.
You know, but there were still some things that you cannot stop taking, or you're going to be very sick. So,
well, a lot of folks that I speak with on the phone, you know, they had an accident, they had a surgery, their doctor gave them a prescription pain pill.
Right.
And when they took it, they said, wow, my brain feels better taking this pain pill.
Oh yeah.
And
oh yeah.
And so that is one of those things that Dr. Sponaugle is very good about discovering. Why does your brain feel better? Where is that craving? And so we're looking at genetics, we're looking at dopamine that a person may be burning, which always has a lot to do with cravings.
And I never understood that until I came here and got schooled on it. It just opened my eyes to it all, and I figured it out.
It's very important because, you know, you're probably, I wasn't in on the medical diagnosis of all this, but you probably have one of them fast running brains that burns dopamine very, very quickly.
You could say that.
And,
yes.
Which, you know, folks like that are usually very capable of doing things. There are people that start businesses and they take risks. They're able to get out there and be very, very successful because of that fast-running brain, that dopamine-burning brain. But on the other hand, they could start a craving.
It gets you. But that's the thing. I mean, when that light bulb went off, like I said, it makes me, I see clearly. I'm like so anxious to just jump back into life and prove to everybody that, you know, I'm back. That's just tough.
And that's it. And you touched on that, and we should talk about that just for a minute, because this part about proving, you know, this can happen to anybody.
Yeah, I know.
You know, this happens to so many people. It's not.
I know.
It's not the unemployed. It's not you know, a certain group of people. It's anybody.
It is. It really does.
That this affects, and we get held hostage.
It's a good word for it.
And it controls our lives when this thing takes place. And so, Dr. Sponaugle has done so much research and understands the brain so well, and is able to get down and pinpoint. For some people, there could be toxins that are involved, you know, accumulation of toxins that are making the brain over electrified, and so maybe they're doing drugs just to calm that brain down. And some folks are being satisfied with that dopamine craving that they have, and so we explore all of those possibilities while somebody's here.
Exactly.
So in a sense, someone's getting almost like a wellness protocol while they're being detoxed.
Yeah, it's more than a detox.
It is more than a detox.
So much more than a detox. I mean, like, you know, I have no craving, no want, no desire for anything. I mean, the only desire I want is to be clean for the rest of my life. I've been terrible for so long. I've got a lot of family members to make it up to, and a lot of children to just show them what the new dad they're going to get. I'm anxious to do it, and you know, I'm never going to look back.
Sounds so exciting, you know, the opportunity that you're going to have. And today's your last day here.
Yes, it is.
Going home, got the holidays ahead of you, and great time to be with family and with friends.
Can't wait. Can't wait.
And then we roll right into the new year, and it's like, you know, our brain kicks in, and we want to get that new job going. And
yeah, got one waiting on me now, so I'm anxious to start, and you know, have myself something to do, and looking forward to it. And none of it would have been possible if I hadn't come here.
Tracy, appreciate your time.
Absolutely, sir.
Sharing with these folks out here. Hope you enjoy the honesty, the transparency that we've had here today, talking about this. And we are a very caring facility, a very special place to come to not only help with the detox process. Tracy mentioned it earlier, but I feel like we are the safest, the most painless, and the quickest detox in the United States. But more importantly, discovering why somebody is chasing the drugs and alcohol. And for many of our patients, it is a matter of the brain.
Absolutely.
And that's something we're very good at discovering.
Absolutely.
Until we talk again, thank you very much for this time. Pastor Philip Johnson, thank you.